So we're going to be talking a little bit about bullying in graduate medical education. There are a couple risk factors, including being female, non-white, shorter than 5'8", and having a BMI of over 25. There are many different sources of bullying, including bullying from attendings, nurses, patients, peers, consultants, and staff. And then a wide variety of bullying has been seen in medical education, including belittling and undermining work, unjustified criticism and monitoring of work, destructive innuendo and sarcasm, and attempts to humiliate. So if you feel comfortable, please raise your hand if you've ever experienced bullying in academic medicine. So I see there are a lot of hands raised. So what is bullying? Another definition is that it's defined in terms of the recipient, not the intention of the bully. The victim is negatively impacted and the bullying behavior is persistent. There are 10 common types of bullying, including nonverbal innuendo, verbal affront, undermining activities, withholding information, sabotage, infighting, scapegoating, backstabbing, failure to respect privacy, and broken confidences. So with this expanded definition of bullying, please raise your hand if you've ever experienced bullying in academic medicine. I know that before researching for this presentation, I was like, oh, I've never been bullied before. But then after like kind of getting a wider definition, it's definitely become more clear that I have. And so we also sent out a survey prior to the presentation and asked a couple of our peers if they had ever experienced bullying. And unfortunately, 41% said yes, which is a really big portion of our respective medical schools. The three most common types of bullying that our peers experienced were undermining activities, verbal affront, and nonverbal innuendo.
So just to give some examples of bullying in different clinical settings, to recap one of the studies that Maddie cited, for medical residents in graduate medical education, the most common sources were attendings and nurses, and it was most commonly reported by individuals identifying as female, non-white, shorter than 5'8", or having a BMI greater than 25. So if we look at the most frequent bullying behaviors, they're really similar to the ones that we saw from the preliminary survey results, especially destructive innuendo and sarcasm, undermining work, and attempts to humiliate. Horizontal bullying is also relatively common. One study examined horizontal bullying among nurses, and 8 out of 9 bullying behaviors were observed by the majority of nurses. And some of these behaviors included covert or overt verbal affront, scapegoating, undermining clinical activities, etc. And a lot of these nurses were surprised to find that these behaviors were categorized as bullying. And when confronted with it, they said that they were often caught up in the moment, or that this was simply a part of the culture of nursing. So family physicians also showed bullying among peers, and 10% acknowledged bullying someone, while 30% had been personally bullied. And women specifically were more likely to experience having their opinions ignored, not being recognized for good work, feeling pressured not to claim rightful benefits, or being given unmanageable workloads.
In a 2009 qualitative study published in the journal Academic Medicine, several third-year female medical students shared their perspectives on why bullying continues to occur within the medical profession. Respondents reported experiencing a gender learning curve during their first clerkship, which was influenced by the perception of differing expectations for male versus female students, and also the lacking presence of female mentorship in the hospital. Given the unfamiliarity and stress of being on the wards for the first time as a medical student, respondents described using a coping mechanism called acculturation. In other words, some female medical students found themselves accepting the gender stereotypes that they encountered while in the hospital in order to reduce the anxiety that comes along with acknowledging that discrimination in a way so it also eases their experience in clerkships, since it's a new thing for them. For instance, some female medical students reported feeling more helpful and appreciated when they complied with the stereotype expectations, which include spending more time nurturing patients and assisting the nursing staff.
So just like we asked about your peers if they had experienced bullying or not, we also asked them if they had felt the effects of the gender differences. And unfortunately, 28% of medical students among our 3 medical schools did say that they had experienced the effects of these gender differences. And so even though some of us might not feel that it affects our day-to-day life, these gender differences have huge impacts on our careers in the future and on academic medicine as a whole. So in this Annals of Internal Medicine paper, it shows that despite equal amounts of male and female medical students, women actually are less likely to hold any type of professorship or leadership positions as compared to men. And as you go further and further up the academic ladder, you see that difference more and more. And even more, unfortunately, you can't say that women and men don't have the same goals because in many surveys, they show that women and men have the same career goals for themselves. And they do have similar achievements, including number of publications, years appointed, clinical outcomes, but they're still less likely to achieve those professorship positions, and they're even less likely to achieve leadership positions in academic medicine. And I think because of these differences, women are less likely to maintain a career in academia. It also matters just for day-to-day life in that women physicians continually make substantially less than their male counterparts. So this is a figure from the 2019 Harvard Business Review, and among both primary care physicians and specialists, the average annual compensation for females is significantly less in primary care providers than it is in in primary care providers that are females than it is for men. And among specialists, we see the same thing. And there are many papers out there that emphasize this point. And probably the most important and unfortunate side effect of this bullying is that there are known and documented effects of workplace bullying on physicians' health. So that includes hypertension, insomnia, GI problems, as well as mental health issues like PTSD, depression, and suicidal ideations. I found this quote that said the suicide rate of male physicians is 40% higher than in the general male population, and that of female physicians is 130% higher than in the general female population. So obviously bullying is a problem in both male and female physicians. But unfortunately, females are more at risk for that type of behavior, and that puts them at greater risk for suicidal ideations and these negative health effects. Also, these are Tina's slides, but her Wi-Fi just suddenly cut out. So she wanted me to share that there are solutions to this problem. We don't want to end on a negative note. So the AMA Joint Commission saw that this was a serious problem, and they sent out a list of steps that people can take to trying to alleviate these issues. So one of them is educating team members on professionalism, creating a zero tolerance policy for disruptive behaviors, and then having clear disciplinary actions for such disruptive behaviors. And then I think a really important part, especially in academic medicine, is protecting those who report or cooperate in the investigation so they don't feel like they will have the negative side effects of that. So that's including hearing and empathizing with the victim, and focus on building trust, as well as non-adversarial interventions. They also pointed out that you should hold all team members accountable. And that's especially important in academic medicine because there's a hierarchy. So an attending should be held accountable just as much as a resident, just as much as an intern. And then there needs to be an implementing reporting or surveillance system. So I'm not sure if you guys have one at your schools, but Hopkins has one called HERO. where you could anonymously report bullying behaviors. And then monitoring system effectiveness via regular surveys. So that's why we really appreciate you guys taking our survey, because stuff like this is important to monitor to make sure we can try to make actions to improve it. And then document all the attempts of disruptive behaviors. So just to summarize, we found this quote by Dr. Alan Rosenstein, and it says, the primary goal should be to improve care relationships by increasing understanding and responsiveness to individual needs, provide training in diversity, stress, anger, and conflict management, and then improve communication and collaboration skills, and enhance an organizational culture that respects and supports physicians, staff, and patient-centered care. So that's kind of all we have. Thank you for listening to us. And we just wanted to now open the conversation, if you guys feel comfortable, about any bullying behavior that you may have experienced as a medical student or resident or intern or anything. And if you felt the effects of this in your daily lives.
Hey, thank you all for drawing attention to this topic, and having a space to talk about it is really helpful. My name is Mary. I'm a third-year medical student at University of Maryland, and something I was surprised at was, or I guess like something I'm still thinking about, and I will appreciate hearing your thoughts and other people's thoughts about this, is that when you report something, I can't help but feel afraid of the reprimandation, or what, the consequences of sharing a story that, I might not even say names, or I might do it anonymously, but if it does get to the person that had the bully, for example, then they would totally, I feel like, know who is reporting this, I think, especially if it were like a one-to-one interaction rather than like a group setting. So I'm still kind of like, I guess my resolution to that is to wait until I finish my, like at the end of my 4 years, basically, and until I report or say something, because unfortunately, it's like in the field that I want to go into, for example, or there's just like, I feel like I'm weighing a lot of risk in reporting now versus like later on when I'm like I have a residency program to go into and things like that. But what are some other solutions that people have come up with or have heard about, or how are you all thinking about this?
I know for me, I also feel the same way. Like if something happens to me, I don't want to report it, but I talk to other like women attendings that I look up to, like kind of just to get it off my chest and like listen to what they think. And even though it doesn't necessarily like solve the solution, it makes me feel better just because it's like, I'm not the only one dealing with this. Like it's happened before. And if it's like a continuous thing, like then maybe the attending can say something like more generalized to other people and like kind of handle it on a different level than through reporting. So that's worked for me before, but it hasn't really like solved the issue. I think kind of, not to be negative, but unfortunately, it's like academic medicine is extremely hierarchical. And until that changes, I think the brunt of the responsibility for this needs to go on the institution setting policies to make this better. And I think educating our peers about it and residents about it is probably the most important step we can take right now to make it better for the future. But it's just unfortunate that we have to feel that way, that that we can't report these like behaviors that are definitely unacceptable. Does anyone else want to share like an instance of bullying that they've experienced?
It wasn't me personally, but I saw it happen. It's kind of sad. I was a medical student, and I remember an intern that I was following, And it was later in the evening, and something had, a patient was decompensating quite fast. And I guess, the appropriate clinical issue, the intern was new. So they were just a few months in as well. They're kind of new to the system. And I remember a senior resident full on cussing out the intern in front of me, a bunch of nurses, and it was just uncomfortable, and I felt so bad. And you could see that the intern was like holding back tears, especially given the acuity of the situation. I feel like that just made it even more difficult to kind of look at it in like try to be more critical of this medical situation. And the unfortunate part, I guess, was later on that same intern who was verbally abused was belittling to my co-med student. So it's just this weird like system of propagation. And yeah, it's kind of sad. It's hard to kind of cut it out, but I think we have to, like you said, we have to make an active effort at an institutional level.
So like Zara mentioned, I've also recently, encountered and even experienced these. Once I saw attendings basically just completely act unprofessional in the wards in front of everyone. And there were other attendings in place, but this sort of behavior never, it just went unchecked. And I think as future physicians, it should also be up to us to, I guess, like put our colleagues in check and make sure their behavior doesn't spin out, because this sort of behavior falls down the ladder and it goes down to residents. And then there are also senior medical students that do the same thing to junior medical students, which really shouldn't be the case, but it is happening. And if you try to address it as, as I guess like the only person, there can be repercussions where you're labeled as someone who's whiny or, out of the crowd. And then you have to deal with that sort of anxiety. It affects your performance. It affects how much you can learn from, because every day you're in the hospital, you want to learn something new. But if this sort of thing is holding you back, it's really not conducive to anyone.
I really like that idea, Lakshmi, about checking our peers, because that feels much easier to do rather than talking about someone above you. And definitely when I'm a senior medical student or an intern or a resident, I'll definitely be calling people out, because I definitely don't want to perpetuate this cycle.
I think you guys brought a really good point about how we're perceived. And I sometimes feel like medicine has this ideology that we must be thick-skinned. And that's always good, right? We should always be thick-skinned. But I think sometimes, you have to acknowledge that words or actions have long-term repercussions. Because, like you said, you don't want to be the only one saying it, or you're hesitant to speak about it later, or you have to hold off on it. And then that raises so many questions later on about the validity of your, just like this whole political gamble.
And I think also it's I feel that there's a difference between I think some attendings will justify it to themselves as oh, I can bully people because it's to learn. And in my experience, I don't feel like being bullied has ever helped me learn anything. I've always appreciated attendings that have high expectations of me, and are stern, but never cross that line into bullying behavior. So I hope that they can fix it. But then I've also experienced attendings that I felt just baby talk to me as a female, and because they didn't want to be a bully, but then I think it just made me feel like I wasn't learning anything. So finding that balance is definitely hard, and hopefully the younger group of doctors can do something to make that culture better.
Does anyone else have anything to share, any like stories that they want to share?
I guess on a positive note, in regards to change, I remember, I guess this is my personal story, not to do with attendings or residents. It was actually a patient, and I remember this was early on in my in med corps, and I had my first time doing doing a rectal exam on someone, and she was an older patient. It took a lot of like convincing. She was going through a lot, and I totally get it. And as I was the last person to leave the room. A nurse and another medical student were with me, and I was the last person to just say goodbye. And in the room was her son, and her son was like, "Hey, if you want to do that to me later onwards, hit me up." And I was like, and to be honest, I was not expecting anything along those lines, right? So I was so confused. I was like, "I'm sorry, I don't understand." That was my response. I was like, "I'm sorry, I don't understand." And then he kind of elaborated, and I was like, "Okay, bye." I'm like, "No, thank you, goodbye." And I had told one of the female interns, and she was so supportive. She's like, "You have to bring this up. You have to draw a line. Just because you're nice and you want to establish rapport with the patient doesn't mean somebody else can walk all over you." And I was like, "That's so true." And I didn't say anything about it, but it's important. Like sometimes we feel like we're stepped over as, I guess, like being at the bottom of the food chain, perhaps, and then being a woman and all of this. But there's people who will look out for you.
Oh my gosh, I'm so sorry that happened to you, Zara.
It's okay.
But I totally want to validate like that it's okay not to know what to say in the moment, and to know, like, to process it afterwards and know what you'll do next time, because sometimes the burden shouldn't be on the victim to correct behavior. So on a positive note, so some of the third year medical students actually wrote a resolution that was passed in the MedChi Medical State Society in Maryland, for the MedChi as an organization to write a letter in support of the Culture of Transformation initiative at UMMC that came out of like litigation about like gender bias and sexual assault in the hospital and things like that. And so in doing this, the medical students, I felt like were able to advocate for other co-students in a more like institutional level, because then it holds accountability. Like UMC had to reply back in the letter saying that they'll continue this initiative and that these are the next steps that we need to take and things like that. And I was really glad that some like medical students are able to help me in doing that. So I feel like it's a good time to be in, where you feel like a little empowered to do something about it. And then there's like things to go, and we could like encourage younger women or non-binary people, or just like to support each other.
Yeah, I totally agree. I feel that this conversation is like making me hopeful for the future of medicine. All right. Does anyone have any other questions or want to share anything? If not, I guess that's the end of our of our day. Thank you guys so much for everything, and thank you for sharing everything and listening. And please reach out if you guys have any questions or anything, or want to continue the conversation.